Good morning, everyone. This is my first live on YouTube, so I'm very excited, and we're going to jump right in. So, this live today is called Why You Should See a Board Certified Dermatologist. I'm Dr. Dina Strachan. I'm an internationally recognized Harvard and Yale educated board certified dermatologist in New York City, and I'm the founder and director of Aglow Dermatology, which is a premier cosmetic and medical private practice in Manhattan. And I have over 25 years of experience helping people with their skin, hair, and nail conditions to help them look and feel their best. In this video, I'm going to break down why it really matters to be a board certified dermatologist, or rather what it really means to be a board certified dermatologist and why it really matters, and whether you're a patient looking for expert care, a student considering dermatology, or a health professional trying to make the best referrals, this video is for you. And before we go on, I'd appreciate it if you'd like, subscribe, and share, and let other people know that I'm going to be talking about this, people you know who might be interested. So why am I doing this video? Why this topic? Over the years, I've noticed something surprising, and I've been in practice over 25 years. Many people don't actually know what a board certified dermatologist is. And why that might be is that things are different now. We have many different providers offering similar services, which is not how it was when I started. This wasn't the case, over 25 years ago. Things have changed a lot. So there are more types of professionals who are not board certified dermatologists entering the space. And with the internet, believe it or not, it can be harder to find a board certified dermatologist, even when there are plenty. If you search for dermatologists, the algorithm isn't necessarily verifying the credentials of the person they're sending you to. A dermatologist, you would only see dermatologists. But on search, you may see people who are selling services or products that may appeal to people who might be looking for a dermatologist. So for example, if you search for dermatologists, you may get presented with someone who sells acne cream online, especially if they have a paid ad. So actually online search can make it harder. And as I mentioned, I'm in New York City, where there is probably the highest concentration of dermatologists, board certified dermatologists. So patients have great access, whereas in some parts of the country, it is indeed much more challenging to find a trained expert. I've had patients who have flown up from places like Alabama and Georgia to see me, in part because of my reputation, but also because, there are other choices where either a 3-hour drive or a 6-month wait to see someone. So in New York, we have convenience. We have many dermatologists who take all kinds of insurances and who are open all hours. But even here, sometimes people have a hard time actually finding a board certified dermatologist, even though there are plenty, because the marketplace can be crowded and confusing and misleading. So I've noticed patients come in to see me for a second opinion, and they didn't realize that the first person they went to who didn't seem to know how to handle their problem wasn't even a board certified dermatologist or even a doctor in some cases. And they just didn't know. They just assumed the person had a white coat. They said they did dermatology, so they're a board certified dermatologist. So let's clear all of this up. That's what we're going to do in this live. And we're going to cover 7 key things, and there'll be a bonus tip at the end. And I want to help you get the most out of your dermatologic care. That's kind of the purpose of this. And to be transparent, I will be talking about this process in the United States. Every country has different training and regulations in healthcare. So I'm just going to check real quick and see if anybody has any questions while we're waiting. I don't see anyone in the chat, so we're just going to keep going. So number 1 is what is board certification for doctors? And board certification is a voluntary process that goes beyond just being a doctor or even having a medical license. It means that the doctor met rigorous standards in their specialty, passed exams, and committed to ongoing learning. Think of it like this. If being licensed is getting your driver's license, board certification is like being trained and tested to drive in the Indy 5000. And honestly, before I went into medicine, as I was going through my career, I didn't understand all of this either. But you will understand by the time we get to the end. But it's a voluntary process of specialty training. So number two is, what's the journey to becoming a board certified dermatologist? All physicians get exposed to a variety of core areas of medicine, and there are numerous medical specialties: family practice, internal medicine, surgery, neurosurgery, radiology, dermatology. With just an MD and a license, a doctor can practice medicine. You graduate medical school successfully, you get licensed in a state, you can practice. Most, however, continue training and become board certified in a medical specialty. They want to focus on a particular area. So even doctors who are in primary care, such as internists, pediatricians, and family medicine doctors, they actually do more training and get board certified in these areas. A dermatologist is what we call a specialist. So a specialist is an expert in a narrow area of medicine. And dermatology is skin, hair, and nails. And a lot of people don't know about the hair and nails part. They think it's just skin. So to become a board certified dermatologist, you have to do a lot. And so for me, I'm going to describe my journey to becoming a board certified dermatologist. And these are the things that I was required to do in order to be able to have that credential. First, I had to complete 4 years of medical school. And after I completed medical school, that meant I was a doctor. Yay, MD. Then I had to pass steps 1 and 2 of my medical boards, and we did that during medical school. So we had to take board exams. That doesn't mean that when I graduated, I was board certified in anything. I just passed the boards. It was a requirement. Then I had to apply and compete to get into an internship program. So internship, some of you might know, is the first year of medical training, and it's generally considered to be the hardest year. You sleep in the hospital every third night. I used to describe it as you had the responsibilities but not the respect of a doctor. And you take care of very sick patients inpatient. And you can do internal medicine, pediatrics, surgery. I think GYNs do their own as well. OBGYNs do their own internship. And dermatologists can do any of those internships. And you have to do one before you can go into dermatology. It's not all Botox and bonbons. You might be doing spinal taps or putting in a central line in someone's artery in the neck, admitting people in the ER. That's the first year of dermatology training. You also have to pass step 3 of your medical boards. We did that during internship, at the end of internship year. So that's 3 board exams. You're not board certified in anything yet, though, when you're a doctor. You're just a doctor in the process of getting certified in something. And then in California, I had to get a medical license on my own in order to continue training after 18 months. I don't know if it's still the same now, but that's how it was back in the 90s when I trained. And so after internship, after sleeping in the hospital every third night, dermatology starts. And first you have to get into a dermatology program, which is very competitive. It's one of the most competitive medical residency training programs there are. And once you compete to get into that means you have to do well enough in medical school to get in. You get to start your dermatology residency program. When I completed my program, which again, a residency program is 3 years of accredited dermatology training, and the curriculum is taught by board certified dermatologists. So it's not just doing whatever in dermatology. You actually have to have certain lectures. You have to be exposed to certain things. An accredited program may have to send you somewhere to make sure you get to see skin cancer. So for example, in New York, we have a different patient population than in California where I trained. And so I know some of the programs send their residents to certain places to make sure they get to see enough skin cancer. We saw plenty of skin cancer in California, but in certain parts of the country where patients have darker skin and there isn't as much sun, you might not see enough skin cancer to be considered board certified and trained. So you must be sent. They have to make sure that you see those things in order for that program to say that they gave you the right training, enough training. So even after you do that, you've done your medical school, you've taken 3 board exams, you've done your residency training, you did your internship, 3 years of residency training. Once you complete all that, you're not even board certified. You're just what's called board eligible, and that means that you're eligible to take the certification exam in dermatology. You can start practicing. Many institutions will allow you to stay board eligible for about 5 years, but you have to pass your exam. You have to take the exam, which is usually 2 to 3 days. I don't know if that's changed, and pass it to be board certified in dermatology. Um, after all that, that was a mouthful, but after all that, after all this, in order to stay board certified throughout your career, to stay a board certified dermatologist, you have to participate in MOC, which is maintenance of certification, to keep your board certification throughout your career. And I will get into that later in this video. So number 3, what's the difference between a licensed doctor versus a board certified specialist, a board certified doctor? So all doctors must be licensed to practice medicine. So when you complete medical school, you're an MD or DO, you are just a doctor. That doesn't mean you're licensed. That doesn't mean you can practice. You have to get a license to practice, and you have to get one in each state that you practice in. But having a license doesn't mean you're board certified. That just means you can practice. You can go treat patients somewhere. If you're a doctor that says, say, like you treat skin conditions, you can do that, but you don't have to be board certified in dermatology. You haven't done the training, but to say that you're a board certified dermatologist, you must have done the training, all the training and ticked all the boxes to show that you have the knowledge and skills to provide that level of expert care. That doesn't mean that you can't treat simple skin conditions if you're not board certified in dermatology. It's just that, you might need to refer to somebody if it's something that is beyond what you are familiar with. And so I think that's important for people in the public to know, because just because a doctor is licensed doesn't mean they're a dermatologist. And just because they're board certified doesn't mean they're board certified in the thing that they're practicing. So number 4, excuse me. So tip number 4 is that, we're going to talk about what's the difference between board certified dermatologists and mid-level providers. So if you are out looking for care in dermatology, you may have non-physicians offered to you, nurse practitioners and physician assistants, and they provide skincare services, even in dermatology offices. And while many are skilled and caring professionals, they are not medical doctors and haven't gone through the dermatology residency or board certification that a board certified dermatologist has. Their training prepares them to be more like technicians. They're supposed to be supervised by physicians, and there's no standardization of that supervision or what constitutes their training. Doesn't mean you can't get good care. It's just that it's really dependent on the standards of the doctor who's supervising them. So, nurse practitioners and physician assistants are often called, mid-level providers. They're also known as physician extenders. And they're professionals. They have licenses, and their training really prepares them to support the activities of a doctor. Mostly they have like a primary care. When they come out, they're mostly primary care, and physician assistants can jump around from specialty to specialty because they're supposed to be closely supervised and always work with the doctor. Nurse practitioners are a little more regulated. They can have specialties, and there are certain standards that they have to do. It seems to vary from state to state, from specialty to specialty, a certain number of hours of practice under the supervision of someone. but they don't do residencies the way board certified physicians do. Um, Increasingly, um, what we're finding, and becomes a safety issue for patients, is that physician extenders are lobbying to work independent of the doctors. They want to have their own practices despite not having the same level of training. They want to work like a doctor without having to be a doctor. And this is happening, ironically, as the standards for board certified doctors who have done most of the formal training is increasing. So I recently read that in emergency medicine, they want to add a year. Their residency training is 3 years. They want to add an additional year to make the doctors who did the training, the accredited training, have to train and make less money for an additional year. Not because they need to. Yet you see nurse practitioners and physician assistants lobbying to work in emergency care, which is quite serious, without doctor supervision. So that seems ironic. The people who trained and did all the training are seen as needing more training, and the people who didn't train are given more independence. So in contrast to the rigorous training I just described to become a board certified dermatologist, a mid-level, such as a physician assistant, does just 2 years of PA school, and then they pass their exam, which means that they're certified to become licensed to practice. That's where you see the credential PA-C. That doesn't mean they're certified in a specialty, but they can be hired to work with any doctor, such as a dermatologist. When I was describing how doctors become certified, remember we take 3 board exams before we finish any residency training, or actually you take 3 before you start residency training, but we're board certified in nothing. PAs take their certification exam when they finish, but often they say that they're board certified and they list specialty, but they haven't done any training. So we'll talk about that more now. So it's not the same thing. They're not board certified, actually. And before anyone says that I am saying negative things about mid-level providers, I'm not. I've worked with excellent PAs and nurse practitioners before, very smart, very good. But these individuals chose to study on their own. They chose to work in environments where they were supervised, they were trained, and that was a choice. You don't have to do that as an NP or a PA, and you can go out and practice. A doctor cannot do that and be called board certified. I've also worked with PAs who, despite having worked for many years, as some of them as many years as I had already worked, they were never properly supervised and trained wherever it was that they worked, and it showed in their work. I was kind of surprised that some of them didn't know how to do basic things that, as a board certified dermatologist, you would have to know how to do in order to be allowed to go out and practice. And they didn't seem to have been trained or supervised. I mean, here's an example. So there are certain parts of the country, say Eastern California, lots of skin cancer. You could have a clinic where that's mostly what you do, skin checks all day. You could do that for years. You could have a Mohs surgeon who's taking off the skin cancers. That's a specialized type of cancer surgery. And you could have a PA who just sutures the patients up for you, and they could be busy doing that all day, and that could be their 10 years of experience. That doesn't mean they show up and they've had any experience even treating acne, warts, hair loss. So they really still need to be supervised, even though they may have had many years of training, because they weren't even exposed to some of the basics, because that wasn't what was being done in the practice where they had their first job. A board certified dermatologist has to have had those types of experiences during their training, and they will be asked questions about it on exams, etc. And I've also interviewed many PAs and NPs who describe themselves as experienced only after working in dermatology a few months. Some of them had never done a biopsy. They had never injected, a lesion on the patient's skin, but they were very much in a hurry during the interview to talk, ask when they would get to be autonomous. Um, as if there's a time versus that they actually achieved the training and expertise to work. And really, in my practice, they would never be fully autonomous because they are not board certified doctors, dermatologists, and that's what my patients come to see. They came to my practice to see board certified dermatologists, not someone who isn't a doctor who wants to be autonomous, who didn't do that training. So I couldn't hire these people because I didn't want to give my patients a lower standard of care. And I was concerned that it would be hard to supervise people who were focused on autonomy versus skills. So again, some people, some mid-level providers work closely with the dermatologist, others don't. So it's important to know who's diagnosing you and treating you. Um, I've seen patients, and as I was their second choice after they went to a practice and they saw someone who wasn't even a board certified dermatologist who was managing kind of a complicated problem for them. And they were starting to get pretty bad side effects, some of them permanent. And, this person, this physician assistant was supposedly being supervised. But, I think a lot of dermatologists would have had been hesitant to manage this problem if they weren't experienced with it. And so I was surprised that a physician assistant who clearly didn't know how to manage this problem was seeing this patient repeatedly without referring to somebody else. I mean, if I refer to other dermatologists for things that I don't feel comfortable with, and that I'm not getting, if I'm feeling I wouldn't get the results I wanted, I'd be quick to refer. I was surprised that this patient was going back repeatedly to this person who was not a specialist. They didn't even realize they weren't seeing a specialist. They could have stayed with their internist. At least they would have seen a doctor. This person wasn't a specialist and wasn't getting them the results they needed and didn't refer to their supervisor. Issue number 5 is, what's the difference between a dermatologist, with air quotes, versus a board certified dermatologist? So this one is kind of tricky too. So here's the thing. The title dermatologist isn't always protected. Some professionals use it loosely, even if they're not trained in dermatology or any specialty. Any doctor can legally say they are a dermatologist, even if they did no specialty training. Licensed doctors are allowed to treat all kinds of problems. I went to medical school. I too delivered babies. I worked on vascular surgery cases, etc. I admitted people to the psych ward. Compared to the general public, I am an expert at these things. However, I didn't complete accredited specialty training in OBGYN or vascular surgery or psychiatry. So, for example, I am board certified, but I am not a board certified OBGYN. I am, however, a board certified physician. That wouldn't be a lie to say. And it just happens to be in dermatology. But I could open a psychiatry practice. I could work from home in my pajamas and do video visits with my patients, and it's completely legal. I could call myself a psychiatrist. And if I want to seem more qualified than I am, even though I am qualified in that I'm a doctor, I completed medical school, I'm licensed, I might describe myself as a board certified physician because I am. But this would probably be to hide the fact that I didn't do my training in psychiatry, which is what the patients I'd be seeing were looking to me for. So I just say be very careful. Know the difference between psychiatrists versus board certified dermatologist, board certified psychiatrist, dermatologist and board certified dermatologist. And you know, you still have to be careful too with that, because despite it even being illegal in some states to use the term ologist if you are not a physician, which is a doctor, even some PAs and MPs claim to be dermatologists when the ologist part in medicine suggests that you are a physician. So a board certified dermatologist has to have earned the title physician, and it means a physician who is trained, tested, and recognized by the American Board of Dermatology. So always look for those credentials. It's very different. So, tip number 6, are non-physicians ever board certified in dermatology? And I'd say the short answer is no. There are no really generally accepted legitimate board certifications in dermatology for non-physicians, non-doctors. You might see terms like, aesthetic provider, board certified nurse injector, board certified physician assistant, board certified family nurse practitioner, board certified family nurse practitioner, dermatologist. Um, but these are not recognized by the American Board of Medical Specialties, which is our national, uh, sort of nationally recognized board in every state. I was considering hiring a nurse practitioner a little while ago, and I'd never hired a nurse practitioner. I worked with some in hospital settings before who were very good. So, wanting to make sure I was doing everything correctly, I contacted the state of New York to learn the rules about how I was supposed to supervise somebody with this credential. And they told me that they only recognize a handful of certifications for nurse practitioners, like family nurse practitioner or geriatric nurse practitioner. Um, and I know that they have some certifications in different states, and there's even some kind of independent for-profit certifications in dermatology where people basically put up a online course and you say how many hours and you can say you're board certified by them, but it's not the American Board of Medical Specialties. In New York, they don't even recognize that. Um, you can get certified in other specialties, but New York State doesn't recognize it. So technically, as a family nurse practitioner, you can do dermatology, but to say you're a board certified dermatology family nurse, nurse practitioner is actually not allowed. So be cautious. And again, they even if they did these courses, they did not do a residency training program. It is not the same as what a physician has to do by any stretch of the imagination. That doesn't mean that you can't give care. It's just different. So you want to be cautious with these titles because people often are misleading with them and they don't reflect their level of training. They're trying to seem like board certified physicians. So the last bit, we're going to talk about maintenance of certification. Now, board certified dermatologists don't stop learning after they pass the boards. So I mentioned all the schooling, training, board exams, you're board certified. We have to keep proving that we're certified even after we did everything. This is quite a controversial thing. Many of us are against this. I'll get into it now. We have to participate in maintenance of certification, which is called MOC. And this includes continuing education, periodic exams, quality improvements in our activities to stay current with medical advances. And this is not, a bad thing necessarily. Just sort of turning it into a requirement the way it is seems odd in this healthcare environment. Yes, we want to make sure that we're offering the best, safest, most up-to-date care. But and imagine, someone who trained decades ago, who isn't up to date with current medications, current treatments, current advances, and they're just practicing like it's 1960. The idea of MOC is to make sure you get the most advanced care. But there's a little bit of a problem. Doctors who did train in 1960 don't have to do MOC. It only applies to doctors who were trained after 1991. So if your doctor was first board certified before 1991, they don't actually formally have to keep up with anything. They can just practice. And doctors who had the more recent training, which is most likely to be up to date, have to keep doing MOC. And then, as I mentioned, non-physicians, nurse practitioners, physician assistants, these are professionals who were never certified in the first place. And they're expanding their scope of practice and independence. They don't have to do MOC either. They don't have to maintain certification and they don't ever have to get it, yet they can practice and practice independently. So think about it. The doctors who did the most training and who are presumably the most qualified to have to continually defend their expertise, while others who never had the expertise can practice without it. And so board certified dermatologists, doctors, ask if PAs, um, you might want to go see a board certified dermatologist. Remember that, PAs can practice independently in some places, NPs as well. They haven't trained and they don't have to do law. So you see, a board certified dermatologist is really the best prepared to provide you the best care for your skin, hair, and nail problems. Are we perfect? Of course not. We're human. But some people say that that's arrogant to say board certified dermatologists are the most qualified. But is it really arrogant to say that, or is it the other way more arrogant? If I did the most school, the most specialty training, and I am required to, and I take an exam that I have to pass, and I'm required to continually keep up with the best practices, is it arrogant of me to say that I'm more qualified than somebody who didn't do any of that, or did a fraction of that? I just think it's actually more truth in advertising. And if we believe that we have something good to offer and that we did all that training because we want to help people with their skin, hair, and nail problems, it would be almost unethical to not tell people that we have that training. And that's the difference between what we have to offer and what people who did not do that training have to offer. I mean, if you want to get diagnosed correctly and get the best treatment options, it's probably better to go to the person who has the most expertise. So our bonus is I'm going to tell you how to find a board certified dermatologist, the real deal. To find a real board certified dermatologist, well, first, of course, you can come see me. At this time, I'm licensed in New York and Connecticut, and my office is in Manhattan. And I also offer video visits, so I can see you even if you can't make it into the city, if that is appropriate for what your problem is. You can also visit the American Academy of Dermatology website, which is aad.org. Fellows of the American Academy of Dermatology are required to maintain board certification. And you can also check on a website called certificationmatters.org. And you can check if someone was ever board certified and if they are currently board certified. So if you learn nothing else, remember you want to look for the words board certified and by the American Board of Dermatology. And don't be afraid to ask. You deserve to know who's taking care of your skin. So I hope this video helped you understand what sets a board certified dermatologist apart and why it matters to your health, confidence, and results. If you find this helpful, give it a thumbs up, subscribe, share it, and drop a question in the comments. And if you're considering dermatology as a career or referring patients, I'd love to hear from you too. Thanks for watching. Remember, your skin, hair, and nails deserve expert care. Get your skin win. And have a good day. Bye.